Hello and welcome. My name is Doris Rajan and I'm with IRIS, the Institute for Research and Development on Inclusion and Society. Warriors Against Violence Society and IRIS are so thrilled to be bringing you this important discussion on access to justice for Indigenous, racialized, 2S LGBTQ+ people with disabilities. IRIS is a Canadian national and international institute, and our work is grounded in addressing systemic exclusion that people with disabilities and other marginalized groups face. For the past decade, we wanted to share with you key results from a 2-year Access to Justice project that IRIS completed in late 2019. We talked to Indigenous, racialized migrant, Black African, 2S LGBTQ+ peoples with and without disabilities connected to what we call local safety and inclusion solidarity networks. Each local safety and inclusion solidarity network in St. John, Toronto, Montreal, Regina, Winnipeg, and Vancouver convened discussion groups with people living with psychosocial, intellectual, and cognitive disabilities who are also members of other populations who have been marginalized. We asked them to tell us about the problems that they have experienced when interacting with the justice system and the things they wanted to see changed. Here is what they said. They talked about the negative treatment and practices by people who work in the justice system, racism, unnecessary use of force, poor treatment by the police, the fear that justice personnel will take away their children. We heard how families, friends, workers often can't deal with the person with a mental health disability or intellectual disability at home, schools, and in support services, but when they call for support, they get the police. That there is a lack of trust and they do not feel like they are being supported when they engage with the justice system. And also that many people we spoke to said that they do not reach out for help due to the shame and fear of reactions from their community, friends, and family. Then they told us what they need. Medical treatment, more wraparound supports, which means supports that address the poverty, violence, health needs, etc., holistic supports for individuals and families. They need affordable, safe housing with supports and options. They want alternative systems of justice, such as First Nation courts and diversion programs for people with intellectual disabilities. Many people talked about the need to educate the community on what they can expect when interacting with the justice system in terms of the processes and consequences of using services. And a big finding was the need for more resources and supports for community-based grassroots agencies that serve Indigenous, racialized, migrant, 2S LGBTQ+ peoples so that they can provide supports to people with disabilities. People had a lot to say in terms of what they believe is needed to improve police services. That the culture in police services needs to change in terms of how they treat each marginalized group, especially when they live with a disability. They need de-escalation practices, more accountability in policing, repercussions for false testimony by police, mandatory use of body cameras. People also felt that they needed to take guns away from the police. Police need to be educated about historical oppression and its modern-day iteration, poverty, systemic racism, ableism, queerphobia. They need empathy and training on listening. And many folks indicated the importance of partnering with diverse communities and allowing populations that have been marginalized to lead beyond consultation. Further, they want to see more equity in practices, such as faster access to legal aid, equitable access to legal supports and lawyers. Decision makers need to be more diverse and reflective of the populations in Canada and be better trained on equity issues. They want ways to ensure court staff are impartial, equitable sentencing, fair treatment and options for mediation between Indigenous and racialized communities, strengthen complaint systems to ensure accountability in the system. People also offered ideas on important improvements to the justice system, including improved prison and remand services, cultural competency or anti-oppression training, culturally appropriate responses, and deeper supports for refugees in domestic violence situations, and understanding structural oppression. A key learning that came out of this work was that there is this tension between law enforcement not being equipped nor their job to be dealing with people with psychosocial, intellectual disabilities in times of crisis, and yet the supports in the community, particularly for Indigenous, Black, African, racialized, and 2S LGBTQ plus peoples, do not exist for people with these disabilities when in crisis situation. And people said the key solution is to develop and fund preventative interventions, increase population-specific community-based supports to divert entry or extensive engagement with the justice system. And the local safety and inclusion solidarity networks that worked on these projects want to develop the models that they have identified to provide the supports needed to prevent engagement with the justice system.